Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Stages of celiac disease. There are 3 stages of celiac disease as defined by the Marsh Score system: a quick and easy to understand way to rate celiac-related damage to the small intestine. You may also hear people refer to the 5 stages of celiac disease, which includes Marsh Stages 1 and 2 and 3 substages of stage 3. /r/n/r/n If you're being tested for celiac disease, your healthcare provider will likely perform an endoscopy and biopsy to see whether your small intestine has been damaged by gluten, a protein found in wheat, barley, and rye. A pathologist will look at your tissue samples to determine if you have celiac disease and how advanced it is. /r/n/r/n Celiac disease is not the only condition that can cause some of these changes. That's why a biopsy is only one of the diagnostic tests recommended for celiac disease. Although a biopsy is considered the gold standard for celiac diagnosis, the results of celiac disease blood tests and the person's ultimate response to the gluten-free diet also can assist in getting the right diagnosis. /r/n/r/n Science Picture Company, Getty Images/r/n/r/n This is a photograph taken during an endoscopy, showing a normal small intestine lined with healthy villi. Since the intestinal lining appears normal, it's unlikely that the person has celiac disease. /r/n/r/n In this case, the biopsy sample would be classified as Marsh Stage 0, also known as the preinfiltrative stage. It's called preinfiltrative because lymphocytes, a type of white blood cell, have not yet started to move into, infiltrate, the intestinal lining. /r/n/r/n Stage 1 celiac disease is when the cells on the surface of the intestinal lining, known as the epithelial cells, have more lymphocytes among them than normal. The presence of too many lymphocytes indicates inflammation and the potential for damage. /r/n/r/n In a normal small intestine, there should be no more than 30 lymphocytes per 100 epithelial cells, but in cases deemed stage 1, there are more than that. If you have stage 1, your pathology report will likely read increased intraepithelial lymphocytes. /r/n/r/n Celiac disease isn't the only condition that can cause an increase in disease-fighting lymphocytes. You may have more lymphocytes if you have inflammatory bowel disease, Sjogren's syndrome, and other food intolerances. Infections with a bacteria called Helicobacter pylori, which is linked to ulcers, and use of over-the-counter painkillers such as aspirin and ibuprofen, also can cause this. /r/n/r/n People with celiac disease who are following the gluten-free diet, close family members of people with celiac disease, and people with dermatitis herpetiformis, an extremely itchy rash that's considered to be the skin manifestation of celiac disease, may also have a stage 1 Marsh score. /r/n/r/n With stage 2, you see more lymphocytes than normal as well as bigger depressions than normal between the intestinal villi. These depressions are called crypts. /r/n/r/n Larger than normal crypts are called hyperplastic. If your pathology report following your biopsy says you have hyperplastic crypts or crypt hyperplasia, it means the depressions seen in your biopsy are bigger than they would be in a normal intestinal lining. /r/n/r/n Stage 2 is pretty rare. It's mostly seen in people who have dermatitis herpetiformis. This rash can appear anywhere on the body, but is most commonly seen on the extensor surfaces of the knees, elbows, shoulders, buttocks, sacral region, neck, face, and scalp. /r/n/r/n Most healthcare providers won't diagnose celiac disease until your intestinal lining Marsh score reaches stage 3. In this stage, the changes of stage 2 are presentable lymphocytes turn normal and larger than normal depressions as well as shrinking and flattening intestinal villi, what is known as villus atrophy. /r/n/r/n Stage 3 celiac disease has 3 substages, /r/n/r/n Most people who are diagnosed with celiac disease have a stage 3 Marsh Score. /r/n/r/n In the original Marsh Classification, stage 4 celiac disease was characterized by complete loss of villi, total atrophy of mucus-producing cells, and increased cell death. /r/n/r/n This stage has since been removed from the Marsh Classification since it is believed to involve different disease processes. /r/n/r/n Endoscopic biopsy is the most accurate way to diagnose celiac disease. This procedure involves inserting a small scope through your mouth and into your stomach and small intestine. This allows your healthcare provider to see the inside of your GI tract and take a small sample of tissue for analysis in a laboratory. /r/n/r/n Video capsule endoscopy, VCE, is a test that involves swallowing a small wireless camera to help your healthcare provider visualize your small intestine. VCE levels of sensitivity are 89%, which means the test can correctly identify the presence of celiac disease about 89% of the time. /r/n/r/n Gastroenterologists use Marsh scores to determine the stage of celiac disease based on the damage to your small intestinal lining. Your Marsh score will determine whether you have celiac disease and how much it has damaged your intestinal villi. /r/n/r/n The gluten-free diet is the only treatment for celiac disease. After you start going gluten-free, your symptoms should improve within a few days, and with time, even bad intestinal damage will completely heal. By managing your symptoms, you can still lead a full life with celiac disease. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.